Hi, I'm Sergio Rivera. Welcome to this video about provider payments and how the United States spends their money on healthcare. Let's talk about the types of provider payments. These are the ways in which health insurance companies pay hospitals, clinics, laboratories, and many other healthcare providers. Most payments in the healthcare system are made on a retrospective basis. This means that providers are reimbursed based on actual costs incurred after services are provided. The most common type of retrospective payment is fee-for-service. In simple terms, providers deliver a service and then send a claim to insurance companies to get paid for that service. Behind the scenes, a relative value unit, or RVU, is assigned to the Healthcare Common Procedure Coding System, which classifies a procedure and provides a certain amount of money for the service. Then, additional adjustments are made based on the experience of the health professional or how long the service takes the provider to complete. This information is used to create a fee schedule by which providers are reimbursed. The resource-based relative value scale for sets of services is a system used in the United States to calculate the standard amount of money that insurers will pay healthcare providers for their services. In this system, each component of the medical service is assigned a relative value unit, a variable amount that reflects the resources that are required to perform the service. RVUs are based on a physician's time and skills, the facility's cost for equipment and staff, and the cost of liability insurance. Managed care organizations, or MCOs, have preferred providers with discounted fee schedules. Here, providers accept discounted fees in exchange for the exception that their patient volume will increase or at least be maintained. Basically, a doctor contracts with private insurance, accepting lower payments with the hope of having more patients. Another type of provider payment is prospective. In this type, the payment is made based on anticipated costs and is a predetermined fixed amount. The payment amount for a particular service is derived based on the classification system of that service. An example is diagnosis-related groups, or DRGs, for hospital and inpatient care. Let's say that a pregnancy DRG is $5,000. One woman can have 10 visits to a hospital and another woman has 3 visits. But since both are with the same DRG, the insurance will pay $5,000. In this example, the risk is transferred to the hospital. MCOs can also do a capitation per member per month and fixed salaries plus bonuses. Capitation, for example, is when a health insurance pays $10,000 for 200 patients in a clinic. It does not matter if the clinic sees 5 patients or 200 patients or 1,000 patients, the payment that the insurance will make is $10,000. Finally, there are value-based payments. These payments will depend on the performance of the provider and the quality of the service. In this type of payment, providers can get bonuses if they exceed goals, or they may incur penalties if they don't meet certain criteria. Disbursement is the release of payment from a payer to a healthcare provider or beneficiary for a service rendered. These payments can sometimes take months and are sometimes negotiated between providers and insurance companies. Expenditures in healthcare continuously increase year by year in the United States. This is due to the introduction of new medical technologies, inflation, and the many for-profit entities that look to increase their revenues every year. Something important to note is that the United States has the highest expenditure on healthcare in the world. The organization of our healthcare system is not good for controlling healthcare costs compared to other developed countries that have implemented universal healthcare systems. A lot of work needs to be done to improve the cost effectiveness of our healthcare system. Thanks for watching this video about provider payments and how the United States spends their money on healthcare.